Hello, everyone, and welcome to today's Keynote webinar titled The Direct and Indirect Impact of COVID-19 Pandemic on Children. This webinar is part of the 8th Coronavirus Virtual Event Series, and I'm Susie Valdez of LabRoots, and I will be your moderator for today's event. Today's educational web seminar is presented by LabRoots. So let's get started. Before we begin, I want to remind everyone that this event is interactive, and we encourage you to first participate by communicating with other attendees using our new live chat feature during the presentation. You can find that live chat located at the left of your screen. You can also participate by submitting as many questions as you'd like during the presentation. To do so, simply type them into the Ask a Question box and click Submit. We'll answer as many questions as we have time for at the end of the presentation. Now, if you are having any trouble seeing or hearing this presentation, just click on that Help Desk button located at the bottom of your screen within the navigation bar or from the lobby. And finally, as a reminder, this presentation is educational and offers free continuing education credits. Click on the Continuing Education Credits link located at the abstract window below the presentation window and follow the process to obtain those credits. I now present today's speaker, Dr. Scott Rivkees, Professor of Practice and Vice Chair of the Department of Health Services and Policy Practice at Brown University School of Public Health. For a complete biography of our speakers, please visit the Presenter tab from the menu at the left of your screen. Dr. Rivkees, welcome. You may now begin your presentation.
Thank you so much. My gosh, it's such an honor to be here. I have to thank LabRoots for facilitating this really important conversation. So I'm Scott Rivkees. I'm a pediatrician, a pediatric endocrinologist, a physician scientist, and before joining the Brown School of Public Health about 6 months ago, I was the State Surgeon General and Secretary of Health of Florida, helping to guide Florida through the initial 2.5 years of the pandemic. And today we're going to be talking about the impact of COVID-19 on children in the United States, building upon my expertise as a pediatrician and also having served as a state health officer. So in terms of the first cases of COVID-19 in the United States, the first reported case in the U.S. was in an adult individual who had returned from Wuhan, China, and this was reported on January 21st, 2020. And as far as when the first pediatric patient was reported to have COVID-19, we don't exactly know who that first individual was, but the CDC in their MMWR publications, one which came out a few months into the pandemic, showed this important graph, which actually showed the initial cases of COVID-19 in children in the U.S., where it appears that the first case of COVID-19 was first reported on February 5th. I emphasize the term reported because there may have been cases earlier, but this was the first reported case, and thereafter we saw the cases really rise quite dramatically. Now, this is not the first pandemic to affect children in the United States, and there's important lessons from the 1918 pandemic. Should point out that in the 1918 Spanish flu pandemic, that children were very, very hard hit. Children less than 5, children between 5 and 10 really had incredible morbidity and mortality. And when this pandemic hit, different mitigation measures occurred across the United States, including efforts to either close schools or keep schools open. And this led to information related to school closure variability, which then allowed us to really study the role of school closures in the role of children, potentially as spreaders of a respiratory pathogen. And shown here is a slide from a classic study by Richard Hatch, Carter Mercer, and Mark Lipschitz. what they found was that when they looked at schools in relationship to early school closure versus later school closure, that morbidity in the community was less associated with early school closure. And this actually allowed other studies to take place, and shown here is a figure from a classic study by Robert Glass and Laura Glass. I believe this was actually a school project that Laura Glass actually conceived, showing how children play a role in spreading of respiratory pathogens. So children have lots of social connections, but children don't live their lives alone in a bubble. So children can actually spread it to other family members, other members in the community as well, which is something that's really important when trying to understand control of respiratory pathogens. And also from this same very important study, when they looked at the ability of individuals stratified by different age groups to spread it, that children generally had the greatest potential to spread respiratory pathogens as compared to teenagers, adults, and older adults. Now let's ask the question, how has COVID impacted children? So shown here are data from a weekly report which is posted by the American Academy of Pediatrics and the Children's Hospital Association. So in the United States, there are about 75 million people in the pediatric population, means individuals who are less than 18 years of age. And so far in the U.S., there appear to be about 14 million reported cases of COVID-19. Now, again, emphasize the term reported because with home testing, other individuals who are symptomatic having COVID not being tested, we know that this number is an underestimate of the true disease burden. But children really, the point here is that children have been impacted by COVID-19 in really extraordinary large numbers. And shown here is also a figure from the American Academy of Pediatrics, Children's Hospital Association, showing pediatric cases in dark blue compared to adult cases, showing that pediatric cases generally follow adult case trends. And then most recently, pediatric cases, these are reported cases, are making up about 14% of the cases. Early on in the pandemic, you'll notice that reported pediatric cases were less than those in adults. However, thinking back to the early phase of the pandemic when we really had testing in short supply, testing was prioritized for individuals who were older. Now, what is our best guess estimate of the number of children who actually may have had SARS-CoV-2 infection causing COVID-19? So the CDC engages a number of laboratories across the United States to actually test samples in a de-identified manner, as broken down by different ages, to assess individuals who have had COVID-19. And this can be distinguished from individuals who developed immunity due to vaccination by looking for certain antigens that are not triggering a response following vaccination, such as the nucleopeptide antigen. And based upon this, it's really fascinating, but it appears that in the groups that they have looked at, that for the individuals 0 to 17 years of age, almost 75% of children have evidence of having a prior COVID-19 infection. And with older age groups, this number decreases, as you see. And it appears that the majority of these infections have occurred most recently during the Omicron surge. Now, how does COVID-19 differentially impact children versus adults? As I mentioned, during the 1918 pandemic, children were especially hard hit by this virus, as were adults. But this is one of the major differentiating features between the 1918 pandemic and the current COVID-19 pandemic. And shown here is really one of the first studies to actually publicly show this. This is actually from the CDC of China, where they actually looked at age-adjusted mortality rates and actually found that this was a virus that was very, very impactful on individuals who were older, and that pediatric mortality was considerably less. The CDC also posts relative risks for cases, hospitalizations, and death on their website. This is a figure taken from the CDC. Here, the reference group are young adults, individuals between 18 and 29 years of age. And what we find is that individuals, again, who are older, particularly individuals older than 85, the risk of mortality is more than 300-fold greater than in the reference group. Hospitalizations 12-fold greater. But in the pediatric population, it is indeed less. It's incredible to believe that more than 1 million individuals in our country have passed away from COVID-19, and our thoughts are with those individuals and their families who have been affected. But within this million are 1,400 children who succumbed to this very pernicious virus. When we look at the age breakdown, between 5 and 18 years of age, we've lost more than 750 children, and there have been more than 100,000 children in this age group hospitalized, a quarter of which have required intensive care unit attention. When we look at children less than 5 years of age, we have 500 deaths or more, and more than 30,000 children who've been hospitalized, about a quarter of which have required intensive care unit care. And what we're also now seeing is that COVID-19 has become a leading cause of death in the pediatric population. It's unusual to see infectious diseases as a leading cause of death in pediatrics. But if we look most recently, where these data are available during the Omicron surge in January, COVID-19 was the 4th leading cause of death for individuals between 5 and 14, and between individuals between 15 and 24 years of age. And if we look at this information further, in terms of what we're seeing in the different age groups, accidents, cancer, children dying by suicide, followed by COVID-19. So again, this has had a dramatic impact on children in the United States in cause of mortality. Now, severe COVID refers to individuals who have manifestations of this illness that either result in hospitalization or, sadly, individuals passing away. And this is an important thing for us to consider and look at. So what is found is that, and this is one of the larger cohorts which is shown here, is that if you look at individuals who have developed severe COVID-19, about 60% have underlying medical conditions, but about 40% do not have underlying medical conditions. And this concept is really important in terms of guiding vaccine recommendations. In terms of what some of these conditions are associated with greater risk of hospitalization or mortality, individuals who have asthma, neurodevelopmental disorders, individuals with anxiety, individuals with depression, individuals with obesity. Now, back when I was in Florida, we did an analysis of individuals who had succumbed to COVID-19. And I should point out that this analysis shown here contains both children and adults in terms of relative risk factors. But again, we see similar parallels. So one of the things that really stood out was the mortality associated and risk related to that for individuals who had Down syndrome, individuals with asthma, individuals with diabetes, pulmonary fibrosis, and also obesity. Now, one of the things that we're actually seeing now is what is one of the greatest risk factors for developing severe COVID. Again, resulting in a child having to be hospitalized, resulting in a child passing away. That has to do with the lack of vaccination. So based upon recent data that have been published, it appears that 80% of individuals who have developed severe COVID are now individuals who have not received COVID-19 vaccines. Another interesting manifestation that we saw with COVID-19 was the appearance of a condition called multisystem inflammatory syndrome of children, or MIS-C. So in pediatrics, there's a condition called Kawasaki's disease, which can really be thought of as a very small vessel vasculitis. It's typically in younger children, less than 5 of age. Children would have bloodshot eyes, they would have rashes, they would have spiking fevers, they would have a lymphadenopathy. And then also some of these children would develop cardiac manifestations with cardiac aneurysms, which would appear. So MIS-C turned out to be something that was really quite similar to Kawasaki's disease, but whereas Kawasaki's disease is really in younger children, this was seen in young children, was seen in teenagers, and also has been seen in adults. And with MIS-C, again, one will see fevers, one can see evidence of vasculitis, lung disease, kidney disease, and also cardiac manifestations, including cardiac aneurysms. The CDC on their website actually gives information about the number of boys and girls who have had MIS-C. And as of the last update in August, there are more than 8,800 children who have had MIS-C. And this illness has been associated with mortality, with 72 children having succumbed to MIS-C and COVID-19. In terms of the different waves when this occurred, this appeared to be more prominent with the original and with the alpha variant waves of COVID-19, but less so with Delta and Omicron. It still is occurring, but we're seeing it less than we had seen in the past. And we're now at the point now where we can start looking at outcome data from some of the children who have had MIS-C. It's gratifying to see that most of these children will recover, but about 30% of children who have MIS-C will have cardiac aneurysms, and this becomes very important in terms of considering long-term follow-up and medical needs for these individuals. In terms of long-term needs and post-COVID conditions we need to focus on, we also need to consider a long COVID, also referred to as post-COVID conditions. And I wish to point out that at the Brown School of Public Health, we have active research programs focusing on long COVID and post-COVID conditions, so we can learn more about this entity. And particularly when it comes to children, more research is absolutely needed. So, we talked about 14 million documented cases, but largely many more cases. So even if a small proportion of children end up having long COVID, similar to adults, the impact of this can be considerable. In terms of manifestations of long COVID, can be broken down to a few different areas. Some individuals will be excessively tired or fatigued. Some children and adults develop what's called post-exertional malaise. So after strenuous activity, they may be exceptionally impacted due to direct effects either on the heart, respiratory system. You can have primary tissue damage, and then also neurologic symptoms are something that we're noticing. Brain fog. Individuals who've had COVID have difficulty concentrating, headache, sleep problems as well. And in comparison with adults who develop long COVID, a few notable differences. First, it's thought that the incidence of long COVID may be less in children than in adults, but again, we need more information about that. And then also, it's interesting that individuals who have asymptomatic infections of COVID may also develop manifestations of long COVID. In terms of individuals who develop long COVID, most individuals are symptomatic, with most cases being mild, but also seen in individuals where this is severe. One of the bigger cohorts looking at what's happening in children comes from the UK. And there, in a large studies that they have, which are still ongoing, they have found that up to 2 to 10% of children who have had COVID will have manifestations of long COVID, with fatigue, anosmia, headaches being among the most common symptoms which are seen. And shown here is a table from an article that was just published, a meta-analysis of long COVID in children, again, talking about neuropsychiatric symptoms, cardiorespiratory problems, other symptoms such as anosmia. So this is something, again, which you're really going to have to pay incredible attention to, again, considering the large number of children, number of adults who have developed, who've had COVID-19. I'm a pediatric endocrinologist, and one of the things that I heard early on from some of my colleagues was they were seeing more cases of children presenting with diabetes. And this is really something that is beginning to be borne out, both for type 1 and type 2 diabetes. So shown here are figures from a very recently published study about pediatric patients showing an increased presentation of individuals who have type 2 diabetes. And then also, there's been an increased occurrence of type 1 diabetes. Shown here are data from an MMWR. This has to do with claims database or diagnosis codes from 2 different health plans. And what was found is that individuals who had developed COVID-19 compared to other respiratory illnesses had an increased risk of developing type 1 diabetes. And again, an article that was very recently published, again, showing this association. So, diabetes, as we know, is an autoimmune disease. It typically takes many years for it to evolve. So this is one of the things that we really need to continue to learn about as to why this is occurring, but it means this is something that we really have to continue to pay attention to. There's another sad impact of COVID-19 on children, and that is the loss of parents, loss of grandparents, loss of their care providers. And this is something which has been seen globally. These are shown here are figures from an article that was recently published showing the global impact of COVID-19. So again, we're talking about a respiratory infection that really particularly affects individuals who are older and adults. And as the result, many children have lost their care providers, parents, grandparents, relatives, other individuals participating in their care. And what is the magnitude of this in the United States? It's estimated that at least 150 children in the United States have had loss of their caregivers due to COVID-19. And I should also point out that this impact on care providers has also followed on the heels of a very serious opioid epidemic, which has had impacts on caregivers of children, caregivers who have had problems with opioid use and things like that. So, here we end up having a situation on top of another very complicated situation, which again is going to warrant our continued attention. There's been lots written and lots of attention rightfully focused on the effect of the pandemic on mental health conditions, both for children and also for adults. And I should mention that this also comes on top of issues related to pediatric mental health, behavioral health, that were noticed even before the pandemic hit us, but this has been exacerbated. Shown here is a result of a survey from Children's Hospital showing the effects of pandemics on teens' mental health. Girls have shown more manifestation, reported more manifestation than boys, but anxiety, depression, sleep issues, withdrawing from families, aggressive behaviors, things that we really need to continue to focus on. And shown here is a figure from a recent MMWR showing the impact of this pandemic on mental health issues, suicidality, intentions as related to connectedness. So in general, individuals who are not connected during the pandemic, meaning that in general they were not at school compared to other groups, showed higher rates of problems related to depression, other feelings of stress, and also attempted suicide. But it's important to point out that whether children were connected, being at school, or having less connectivity, studying virtually, problems were seen in both groups. And sadly, we've seen increased numbers of children who have died by suicide. Shown here is a study that actually put together information from 14 states where these data were available. Again, showing that we're seeing increased individuals who have passed away, who have died by suicide during this pandemic. And then just last week, another report was published in MMWR, again showing manifestations of the pandemic. But this study also is very important because it also shows the link to prior experiences, things referred to as ACEs, adverse childhood experiences, and this can refer to individuals who have experienced violence, witnessed violence, other types of stresses and things like that at home. And individual and children who are in those types of settings are more at risk and have a higher incidence of having problems related to mental health. So again, these are really important take-home messages that if that parents need to talk with their providers. If, children showing signs of being anxious, moody, changes in grades, changes in other behavioral activities. And we should also know that there now is expanded support for mental health services in schools through Medicaid. And this has been adopted in a number of states across the country, where within schools, if mental health providers are employed by different school districts, that Medicaid will end up covering costs for mental health services for these individuals. But I do wish to point out that we certainly have areas of workforce shortages in healthcare in the United States, and one of these areas where it is especially acute has to do with child and adolescent psychiatrists. So again, we have almost 75 million children in the United States, and we have about 10 million child and adolescent psychiatrists. So pretty much every state across the country has a severe shortage of mental health physician providers. We've also seen impacts on education. So early in the pandemic, March 16th, Ohio was the first state to close all schools as part of mitigation measures related to COVID-19. And soon thereafter, school closures spread throughout the United States. So probably about its peak in March, that more than 55 million children who previously went to face-to-face education were now having education virtually following face-to-face school closures. And then beginning in the fall of 2020, sometimes summer or fall of 2020, some children in some states started going back to school face-to-face. Again, there was tremendous variability with this. In some states, all school districts were required to have face-to-face options. Other states continued education virtually, and other states ended up having hybrid approaches. I think it's fair to say that by the fall of 2021, that in most states, children did start going back to school. But again, we saw lots of variability, and this time the variability often was related to state masking policies. Some states mandated masks for children in schools or school districts, and other states it was prohibited. So this is an area that really is important to investigate, and what is the impact of different school mitigation models on COVID-19 incidence, severity in different communities. And shown here is a paper published in Nature Medicine looking at this, generally showing that when students were either back virtually, hybrid, or face-to-face, that community rates were generally the same, although there were some differences. And this is one of the things that we really need to study, is there's so many different models of what happened with children going back to school, what worked and what didn't work. Another thing that if we think back at is, certainly going back to times when schools were, conversations were happening in communities about children going back to school face-to-face, or are they going to wear masks or not, is the community strife which was happening. School board meetings often became very, very contentious. We ended up having threats made against educators, against healthcare providers, against other members in the community. And we also found certain areas where there was active defiance against state orders. So we also have to ask ourselves, we recognize the fact that our children were watching, and what is going to be the impact of this when children see so much strife that is going on within communities. One of the things, though, that is clear is the impact of the pandemic has had on educational achievement. Shown here is a report from the Brookings Center, where you end up having different age groups where they ended up looking at performance for math and reading at this time compared to the pre-pandemic situation. And generally, what's being found is that these children have gotten behind on their education. And one of the questions is, what is it going to take for these children to catch up? And then again, very recently released are results from the nation's report card. This is a survey which is done looking at math and reading scores for children who are 9 years of age, again showing a decrease here. And we know that these educational challenges are also heaped on top of national teacher shortages. With it being estimated that there are more than 300,000 teaching positions that need to be filled across the United States. So again, an important area that is going to warrant our close full attention. Now let's talk a little bit about vaccines and vaccination. So, we all should really be in awe about, it's just incredible when you think about that within a year of the pandemic starting, that we had vaccines developed. I mean, vaccines have never been developed in such an incredible period of time. And this achievement was recognized by Science Magazine in 2020 as the breakthrough of the year. And as vaccine has become increasingly available and more studies are done looking at its safety and efficacy, we're now in a situation where all individuals in the United States who are 6 months of age and older can now receive COVID-19 vaccines. One of the things we talk about in the pandemic is authoritative sources, and one of these is the American Academy of Pediatricians. And I wish to emphasize again, this is from the AAP website, and they also had infection control committees, vaccine committees, who actually can look at this information. And the AAP overwhelmingly recommends COVID vaccination in the pediatric population from 6 months of age and older. And as far as their efficacy, again, these vaccines are effective even against Omicron. This is a recent publication, New England Journal of Medicine, looking at the efficacy of the mRNA vaccines against Omicron, and these vaccines are 80% effective in preventing severe Omicron. Now, getting back to the issue as to which children should get vaccinated or not, the recommendation is that all children should get vaccinated against COVID-19 because you cannot predict which child is going to get severe COVID. As mentioned several slides ago, is that about 60% of children with severe COVID have underlying medical conditions, but about 40% do not. So the recommendation is that all children get vaccinated against COVID-19. Now, this also is something that's interesting and something that, again, warrants attention, and that is, if we look at individuals who are vaccinated against COVID-19, and this is the primary series, what we find is that the younger a child is, the less likely that child will have been vaccinated. So among individuals between 12 and 17 years of age, nearly 17% of children in this age group have had their initial doses of vaccines. Between 5 and 11 years of age, about 38%. But in the young children between 6 months and 4 years of age, less than 10% have had their initial doses of vaccines. And this is shown pictorially in a figure from the recent vaccine report from the American Academy of Pediatrics, again showing higher proportions of children who are older getting vaccinated compared to children who are younger. And as I mentioned in the earlier slides, is that if you look at children who are less than 4 years of age, we have at least 30,000 hospitalizations. We have at least 500 deaths in this age group. Now let's also talk about boosters. As we are aware, a new bivalent booster has become available. And just last week, this bivalent booster was approved for children between 5 and 12 years of age by the CDC. And in terms of what the current recommendations are, again, this is from the CDC website. So again, between 5 years of age and older, bivalent boosters are available for the pediatric population. But similar to what we're seeing in primary vaccination rates, same holds true in terms of boosters, children compared to adults. So this actually shows first booster doses and second booster doses. But for the first booster doses, which are approved for the pediatric population, what we find is that individuals who are older are more likely to get their boosters, and then it decreases with progressive ages. So that if you look between the 5 and 11-year-old age group, that about less than 20% of individuals who are eligible have gotten their booster doses. We've also seen effects of the pandemic on other vaccinations. So this study was published at MMWR. It came out of Michigan, showing that in the early phase of the pandemic, certainly over the first year, that routine pediatric vaccinations had declined for infants. And this is something that is now being seen worldwide, where there has been a decrease in terms of basic protective pediatric vaccinations, such as those against measles, such as those against polio. And it's not just overseas where this is happening, it's actually happening in the United States. Again, this is a recent MMWR in this situation, looking at measles, mumps, rubella vaccination. And as we know, measles is a very highly contagious virus where you really have to have at least 95% immune protection to protect the community. And this red bar shows the 95% line, and we're now seeing a number of states where we are dropping below this benchmark. We also are now getting into flu season. The past few years, influenza activity has been relatively modest. It's thought that this may be reflective to the non-pharmaceutical interventions that have been introduced for helping to control COVID-19. CDC posts their flu view on a weekly basis, and this is showing that we're now starting to see some upticks of flu in the United States. But again, I want to go back to a really important point, and this is that COVID is much more lethal than flu in children. In a bad influenza year, up to 200 children may lose their lives due to influenza. And over the past two plus years in this pandemic, we have lost more than 1,400 children due to COVID-19. So again, when we talk about flu vaccination, we really also need to be considering COVID-19 vaccination. In terms of when to get children vaccinated, already in many schools across the country, pediatricians are offering this flu vaccine. And typically we're saying is, try to make sure you get your flu shot before Halloween. In terms of different flu vaccines that are available, there can be flu shots for children 6 months of age and older, and then also there is the flu mist nasal spray, which is protective. In addition to seeing recrudescence in flu, we are also seeing an increase in acute respiratory illnesses, to the point where a few weeks ago, the CDC actually sent out a health advisory network alert, alerting the pediatric community and the medical community at large about the increased activity of respiratory illnesses that are being seen in children. These pathogens include rhinovirus, enteroviruses, human metapneumoviruses, other viruses, which will cause respiratory illnesses, which can also be quite serious. And then, we can't talk about the pandemic of COVID-19 without talking about the pandemic of misinformation. This is something that, continues to manifest itself, something that we really have to continue to make sure that individuals in the community have proper information. It talks about hydroxychloroquine, ivermectin, that vaccines are not safe and or could be toxic. There's a lot of messaging going out about this. And I found this really fascinating. This is a study that was released several months ago, just talking about the scope of COVID-19 vaccine misinformation. So again, this is a study involving thousands of individuals across the country. So in terms of the question, do these vaccines cause infertility, making it to become pregnant? Well, 10% of people think that this is an accurate statement, and 32% think it's unsure. The thought that it can alter DNA, 8% thinks that's accurate, 24% are not sure. So, these microchips, individuals believe that this may contain microchips. 19% are not sure about this. So again, we always say, have conversations with your healthcare providers about these issues. And U.S. Surgeon General, Dr. Vivek Murthy, has issued a report talking about the importance of how we need to address this. And the American Medical Association has adopted policies, guidelines about this, what can do. But it really comes down to a few things. Making sure that the public has the facts about COVID-19 so that they can make judgments for their own, and that we do our own job in terms of communicating these facts. And this is where the American Academy of Pediatrics, again, they have lots of information, tools which are there, and can be used as an authoritative source of information about COVID-19, as are many other medical societies and organizations for this. So where are we now? So here we are on October 19th, 2020. Wish to emphasize that, COVID-19 is still around. We're having more than 30,000 new cases of COVID-19 diagnosed per day. These are ones that are reported. There are more than 3,000 individuals newly hospitalized a day from COVID-19. And we are having more than 300 people a day lose their lives to COVID-19 infections. So COVID-19 remains a very serious infection which is with us. In terms of children, out of our 75 million children in the United States, we have at least 14.8 million reported cases, but a far higher number of cases based on serology studies. And it's the point now where COVID-19, at least back in the data in January, it's one of the leading causes of death for children. And we've lost more than 1,400 children due to COVID-19 and have had 130,000 children who have been hospitalized by this. So in terms of challenges ahead, we're going to have to continue to look at the educational and social impacts of this pandemic. What is the impact of the community discord that we have seen related to schools and other aspects of community discord related to mitigation measures? We've seen an incredible mental and behavioral health impact at a time when resources remain an opportunity. We've seen children lose their care providers due to COVID-19, parents, grandparents, relatives, long COVID. Again, even if this affects a small proportion of children who have had COVID-19, same with adults, because some people have it, what is going to be the impact on this? What is the impact on other immunizations which protect really important illnesses like polio, measles? And then also this pandemic has really seen an erosion of trust in the expert. How are we going to be able to build that back? How do we get our patients, how do we get our public back trusting us so that they end up listening to us? And this gets into the issue about how are we going to deal with a pandemic of misinformation, which has implications beyond COVID-19. So I want to thank everybody for your attention today. And again, it's really been an honor to speak with you. And I really have to thank LabRoots for making this conversation possible today. Thank you.
And thank you, Dr. Rivkees, for that informative presentation. We will now start the live Q&A portion of the webinar. If you have any questions you'd like to ask, please do so now. Just click on that Ask a Question box located on the far left of your screen. So let's get started. It looks like we already have some great questions coming in. This is a two-part question. Can you address the following? Dr. Paul Offit, vaccine expert at CHOP, is on record stating that healthy young persons who have previously been fully vaccinated against SARS-CoV-2 do not need additional boosters with bivalent COVID vaccines. Based on the current vaccine data, there is a growing number of parents and pediatric providers that agree with him. What are your thoughts?
Yeah, I haven't seen Dr. Offit's comments, but I will say, in terms of what is currently being recommended by the CDC, as opposed to some of these recommendations there, the CDC is recommending that individuals who are eligible for boosters, who have not received boosters within the previous several months, receive the bivalent booster.
Thank you so much. And would offering vaccines at schools or work help with vaccine uptake?
Yeah, that's a really great question and a really important question, and it's a question we have answers to. So really starting back when vaccines became available, many parts of the country, vaccine clinics took place at the workplace, and then also in schools. And I know even now, there are many school districts now where children will be able to get vaccines with their parents' consent.
Thank you so much. And I want to thank our audience members for these great questions. Our next one coming in, regarding the overall decline in vaccine uptake, is this attributed to the negative perception of COVID vaccines, or is this something about vaccines in general?
Again, a really important question. So, one of the things that even before this pandemic, there was a very strong movement which was growing against vaccination. And I think it's fair to say that during this pandemic, that this anti-vaccine movement has continued, if not being accelerated. So this gets back to the point about authoritative sources. Who are the trusted experts? I think one of the things for all of us to do is really make sure that we have a voice in the community, that individuals who are healthcare providers can be able to address this issue. Because if we are continuing to see decreased vaccination rates among these vaccines, which play such an important role for children, we are going to see potential outbreaks of diseases that we thought really had been largely mitigated in the past.
Thank you so much. Now, would the end of EUA help with vaccine uptake?
Yeah, that's an important question, and people have talked about this, but I think we're at a point now where there's so much information out there about vaccines. There have been more than 600 million doses of COVID-19 vaccines given. They've been shown to be very efficacious. They've been shown to be safe. And so, with that, information is out there for individuals to be able to make their opinions about the safety and efficacy of these vaccines.
Thank you so much, Dr. Rivkees. We have one more question coming in from our audience. Will immune imprinting be a problem with the bivalent vaccine in children less than 12 years of age?
Yeah, I'm not sure what the term immune imprinting necessarily means, but I will say this, is that, children have been vaccinated against a multitude of illnesses. And vaccines have played a very important role in conquering lots of these illnesses. And so in terms of how we look at COVID vaccines, it would be similar to how we look at flu vaccines, measles vaccines, pertussis vaccines as well. So again, I think the message here is that the biggest group of children in the United States right now getting severe COVID are children who have not been vaccinated, and that these vaccines have a good proven efficacy record in preventing severe COVID, and that these vaccines have excellent safety profiles.
Dr. Rivkees, I want to thank you for your time today. Would you like to provide any final comments for our audience?
Yeah, listen, thank you so much. It's a really important conversation to speak about children. As I mentioned, we are seeing a significant COVID morbidity in the community, but it's also great that our kids are back to school. Kids are going back to sporting events. Kids are back to socialization. Kids are back in school getting caught up on many of the things that they got behind on during the pandemic. But we have looming challenges ahead of us, which include medical challenges related to COVID, societal challenges related to impact on care providers, and then also mental health challenges. So this is something that, even though cases are going down, we're all going to have to do our job on behalf of the boys and girls in our country. And I want to thank everybody on this call for the job that you have done during this pandemic and how you have helped individuals of all ages, including children.
Well, I want to thank you again, sir, for your time and for your important research. And before we go, I want to thank our audience for joining us today and for their interesting questions we did not have time for today, and those submitted during the on-demand period will be addressed by our speaker via the contact information you provided at the time of registration. And this webcast can be viewed on demand for 2 years until October 19th, 2024. LabRoots will alert you via email when it's available for replay. We encourage you to share that email with your colleagues who may have missed today's live event. Until next time, take care, everyone. Bye-bye.